Cleft lips and palates affect children the world over, but they can be solved in an operation that takes less than an hour and is relatively straightforward and inexpensive. Join me, Clemency Burton-Hill, as I follow the Operation Smile team in their latest bid to change lives, one smile at a time.
Operation Smile to me is the ability to make a difference and to help others make a difference.
Yeah, fixing cleft lips and palates is really rewarding surgery, particularly the cleft lips, because there's an immediate, visible result.
It's a chance to change a child's life in that they don't have to hide, they don't have to be ashamed, and they can make friends or go to school or, you know, have a life, have a new life.
Hello, I'm Clemency Burton-Hill, and I'm here on Market Day in central Madagascar. Lying off the southeast coast of Africa, Madagascar is the world's 4th largest island. But unfortunately, despite all the economic hustle and bustle you can see going on around me, it's also one of the poorest countries in the world. I'm on my way to one of the main cities on Surabe, whose population is not much more than Oxford. I'm travelling south as I've been invited by a team of medical volunteers to follow their life-changing mission to help children born with cleft palates. Good morning, everyone. How are we doing this morning? Did we sleep well?
Yes. This is my first time in Africa, so I'm very, very excited to be here. But I'm going to assume it's going to be certainly at least a little bit different. Well, you never know what to expect.
I'm really excited. Nervous? A little bit, a little bit. Such deformity is a much commoner sight in the developing world, since the vast majority of people can't afford the kind of corrective surgeries that we take for granted in the West. For the last 25 years, this charity, Operation Smile, has provided free reconstructive surgery to children across the world. But with 200,000 children born every year with facial deformities, their work has only just begun.
My name's Natalie Miller. I'm Regional Director of Operation Smile in Southern Africa. And one of the reasons and one of the ways that we introduce ourselves to the ministries of health in Southern Africa is by explaining to them that we know that they have huge priorities like AIDS and malaria and tuberculosis, but with cleft lip and cleft palate, it's one of the top 4 birth defects of children, and it gets pushed aside. Children are born not being able to suck. They can't feed. A lot of babies are malnourished. A lot of babies die before 1 or 2 years old. If you don't get their lips and palates fixed early, they're going to have speech abnormalities, trouble breathing, and that's not even taking into account one of the biggest things, which is the social stigma.
On the first morning after arriving in Surabe, I met 2 young mums whose babies had been born with cleft lips. They'd heard about the mission on the radio and explained to me about how the surgery would help them. They talked to me in their perfect French about how they wanted the surgery for more than what we might consider just cosmetic reasons.
Essentially, she said that because it's so difficult to swallow because of the situation with the palate, often they can't get the liquids down at all, so very often they come out through the nose and they actually just physically can't get the nutrition in. So they have to be fed at a very certain angle, which is what we're doing here now. And it seems to be going down well, touch wood, for the moment. But it's obviously very distressing for the mother to not be able to feed her daughter in a normal manner that we're so accustomed to. Merci beaucoup. Thank you, guys.
My name is Claire Denny, and I am a mission coordinator from Operation Smile International. The majority of advertising we do is over the radio. We also do TV and newspaper ads, but because there's tons of people who have no access to newspaper or TV, a lot of the word is spread by radio. And also it's word of mouth, being aware. The Peace Corps volunteers have spread the word way out into the villages that we could have never met before. So a lot of it is thanks to the Ministry of Health putting up posters and radio ads.
This one-week mission hopes to repair the lips of deformed children with the help of international aid and volunteers. But as hundreds of expectant children begin to arrive, many travelling hundreds of kilometres by foot, we begin to realise just how great the need really is.
So Damien, tell us, what's going on outside the hospital right now?
What we have going on right now is all the patients that are waiting to enter the screening area, enter the hospital. So they're being interviewed, asked where they're coming from, getting their name, the region that they're coming from, at which point we'll take them down to the screening area to start the process.
And what happens next? What happens when they go into the screening area?
We'll have them go down in the screening area, and then there they'll have their vital signs taken. They'll be checked out by a dentist to see if there's going to have to be any dental surgery. Also, anesthesiologists will check them out to make sure that they're healthy enough to be put under anesthesia for the surgery. And they'll have a surgeon check them out to see exactly what needs to be done.
Ça va? I found a local man who helped me talk to the families queuing at the hospital gates.
She's very shy, but he can speak. He can speak clearly.
Bonjour. Ça va? Hello. Salama. Has she come far today?
The name of the region is Tichiba in the west also.
Far?
Yeah,
And they've come all this way?
Yes.
There are obviously hundreds of people here today, and I'm not sure how far you can see, but the queue is stretching all the way. There is such a plethora of different stories, obviously very different conditions. Some of the children have a single cleft lip and no cleft palate, and that's very, very serious in terms of the social stigma, in terms of their ability to be educated. If they're young children, they get ostracised at school, but obviously for the adults it's very difficult as well. It's very hard to find employment, and it's just overwhelming talking to these people. There are obviously some very anxious parents here as well, so we're hoping that as many as possible can be operated on and helped. This mission is dependent upon the successful coordination of all the medical aid that the charity has summoned. But with hundreds of families looking for surgery, this could be their greatest challenge yet. Like, the numbers are completely overwhelming, aren't they?
Yeah, this is actually less than half the patients we have. We want to walk down the screening area and check that out. There's a lot more down there.
Okay, come show me.
Okay.
Do we have any idea yet of what kind of numbers we're talking about?
It's looking like about 500 or so. Yeah.
And is that standard for Operation Smile?
That's a good number for us. Yeah, very good. Yeah.
The number of operations this week, because we're going to be doing mostly cleft lip repairs, will probably be somewhere in the range of 40 to 50, I think, for each surgeon. So that's more than usual.
The team is going to be arriving tonight. I think they're on their way with the bus already. The main team.
The team's going to be stressed, and I think it's going to be one of the challenges that we're going to have this week is to keep the morale up and keep them energized. And the surgical part of the mission is probably one of the easier parts, although it seems to be, it's more dramatic and sometimes seems more difficult, but looking after the children and the families is very challenging and stressful and often quite exhausting. So that's going to be the part that's going to be difficult.
The screening process, which is going on all day around us, as you can probably see and hear, is a chance for the medical professionals to assess each potential patient and work out which operation they can have, if indeed they can have any.
But it's also a chance to learn more about their lives and their condition.
This child is a bit more complicated because the lip is a bit recessed down in the intralip. So we can have, it's a bit more complicated.
Cleft lip and cleft palate are two separate entities, although often they occur at the same time. But a cleft lip is a gap in the skin and muscle and lining of the mouth that runs from the edge of the lip right into the floor of the nose. And it can either be cover the whole distance and be a complete cleft lip, or it can be incomplete where part of it is not together and part of it is together.
This will require fairly extensive surgery to try and mobilize it. So that's going to take a bit of time to do that.
How long approximately will it take?
It'll take about 2 hours operation.
2 hours?
Yeah.
Often exhausted and hungry from their journey, these examinations seem to be quite distressing for the children and their parents. I spoke to Angela, a volunteer nurse from the UK.
The parents at the start in screening are extremely nervous, and I think that's why we get a lot of upset children as well, because you can feel it from your mum and dad if they're anxious. They don't understand even things like standing on the scales. They don't know if it's going to hurt their child or not. So they're trying to tell their children everything's going to be okay, the children are crying. Our faces are very alien to them as well, and we're straight in there, prodding and poking, so the parents are anxious. They're extremely anxious during the surgery when they're staying on the ward with us. And then the moment they see their child, they just want to grab them, hold them to them, have a look at them, make sure everything's okay. Once they know that and they can see that and that we're smiling and saying it's good, then the reaction is incredible.
What type of antibiotics would you give?
Okay, and so you come 200 kilometers by foot. How long has that taken? So this family have walked for the last 3 days, not wearing shoes to get here. So that is extraordinary. This family have walked for the last 3 days to get here with no shoes. They've never seen a car before, and there's a car parked out there, so that was a great surprise. And we just hope that their son is able to be operated on, because apparently people around him are very scared of the way he looks. There's no one else like that in the village, and so they're hoping that if he can be operated on and his lip can be reconstructed, he'll have a happier time. But it's an extraordinary tale of dedication.
Medically, we don't as yet know why babies are born with this deformity, and it strikes me that at the same time, I'll never understand just how distressing this problem can be. The main concern right now, of course, is to operate on as many children as we can. It won't be until tomorrow that this little boy and his family find out whether he will be turned away or not.
Madagascar, nous y sommes bâtis.